Hello, everybody, CNY family. Welcome to our Monday night chat for the global travel team. As you can see, I've brought back one of our show's favorites, Miss Linda. How are you?
I'm good. How are you guys?
We're good. We're good.
It's
It's
good
a
to see
Monday.
you.
It's so good to see you. It's a Monday, but that is okay.
Yeah.
While we wait for some people to get on, I'm just gonna, for those of you who haven't seen the show before, I am Elizabeth. I'm one of the travel nurses here at CNY Fertility. I help to run our travel program for all of you who come to us from other parts of the state, the country. So we're so happy to have you. These Monday night chats are just kind of designed to focus on the travel portion of things, but obviously with reference to what you might be doing in your cycle. And I like to bring Linda on at least once a month because she is our liaison. What's your actual title?
I'm the fertility nurse liaison for Metro Drugs, but I've been a fertility nurse for like 15 years, and now I help try and bridge that gap between the medication questions, all the medication questions.
Love it. Yeah. So Linda kind of goes between our clients and Metro Drugs, one of our partner pharmacies, to just kind of help make the process easier for all of you. And that can look like anything from answering a quick question to FaceTiming. And we could talk kind of about that later. But, I'm just so happy that you're willing to join us and tell us all that you know and all the helpful hints. So, I know you kind of wanted me to talk real quick about what happens after you have your new consultation, because that'll kind of lead us into what we're doing. And that's just will be great while people start to join us. But once you have your new patient consultation, we know you're eager to get going. You've been waiting for the consultation for a while, probably. And so you're eager to get this process going. And so in terms of what happens once you have your new patient consultation with one of our providers, the next thing that's going to happen, usually within about 24 hours of you speaking with the provider, is we're going to reach out over the patient portal and kind of give you some stuff to just to sort of browse over while you wait for us to give you a call, because the nurses will call you, will reach out usually within a couple of weeks of your new patient consultation. So if you find that it's been more than 2 weeks, definitely reach out. We're not perfect, so sometimes wires get crossed, but definitely let us know if you've been waiting more than 2 weeks. But essentially, once that process, the ball gets rolling, we're going to send you not necessarily your med list right out of the gate, which I know is really important. That's what everybody wants right away. But what we typically send you is some packets of information to take a look over. And then we give you that call within 2 weeks. And once the nurse gives you a call, it's going to be during that call, she's going to send you send all of your meds in. And so basically we order your medications, and then the pharmacy then the ball's sort of in the pharmacy's court. So Linda, once I order all of those meds to Metro, what happens on your end?
So I love doing this with you. I just have to say first, because I love being able to support the whole CNY community. I know it's overwhelming at first, like you just said, and all this information is kind of coming in, and it's kind of hard to translate all of it. So once the medications are ordered through a pharmacy, so in an example of with Metro, what'll happen is they'll receive a call or they'll communicate via email about everything, and then they'll receive their shipment. So these medications, and if you're in different groups, and I know you're researching things, it can be really time consuming to try and figure out, like, okay, where can I save money and things like that. So in our instance with Metro, they're very competitive, special CNY pricing. But with all fertility pharmacies that CNY is working with, I can speak on behalf of Metro that shipping the medications the way that they're shipped is really important, right? So for the stability of the meds, they have to be shipped, some of them with like freezer packs, and their vials and things like that. So it does matter where you get the meds from. As an example, you might receive like a puffy pack with your meds in them, with a bunch of instructions saying like refrigerate upon opening, don't throw anything away. And it will contain the needles, the syringes, the alcohol swabs, all of the medications. My role is to just make life a little easier, right? Because it's so overwhelming when you receive that. And it's exciting, but it's also like, okay, what do I do with all this? So I'll run through an inventory of what these medications are. What am I using first? Today, for example, I got a call. We did a quick FaceTime. And the first question was, do I have to inject anything into my backside, into my butt? And I was like, nope, that's
not yet,
that's
sister.
down the road. So let's go one at a time. We talked about follow-stim first, did a demo and explained everything, and just kind of like tried to provide some encouragement, kind of slow things down, break everything up, and just kind of run through it step by step. So that's where I feel like trying to provide support throughout the whole process, especially when we're gearing up and we're learning how to do these meds for the first time. I get looks all the time when I'm like, I promise you, you can do this. I know that nobody likes shots. The needles are tiny, but I know that doesn't mean much right now, but you've got this. And like, I'll get a look like, oh, you think so, do you? I don't know about this. And I'm like, I get it. So let's do it together. Right.
Yeah.
And then in a couple of days, like, we've achieved that and we're on to the next, step and the next step and the next step. So like, I always kind of break up the cycles, like from stim onward to procedures. And then, after that, what does it look like for everybody?
Yeah, no, absolutely. Can we even back up a little bit? Tell me what's going to happen. So I'm your patient and CNY facility just sent all my whole order to Metro.
Yep.
What happens now? Do I need to call Metro? Is Metro going to call me? Let's back it up all the way.
So if the meds are sent to Metro by CNY, which is awesome, you can follow up and email me, Linda S@metrodrugs.com. On Instagram, if you DM me, I'll be able to keep track. I'm at Unboxed Mom. And we'll go ahead and get your order processed. We'll probably ask when you're starting so we can get the timing right and things like that. Once the order is received and shipped, the box comes, like I said, the packs all come, and there's something like an insert included saying, speak to our fertility nurse, Linda. She will walk you through everything. What questions do you have? Some people I find just feel more comfortable sending me a text message, which is totally cool. Like at any time, like Saturday, somebody sent me a text message, no problem. Sometimes somebody's like, I'd like to set up an appointment and run through everything, and we can do that. And I just like to slow things down and have that one-on-one time to just walk everybody through it so that they feel as empowered and ready to start their cycle as they can when they get their instructions to start from CNY. So we're kind of working in tandem.
Yeah, absolutely. That's such a good point. What can I expect, or what should I expect in terms of is Metro going to run my insurance and tell me if there's any coverage on any of the stuff, or is it all cash? How's that part work?
That's a great question. So here's the deal. There's CNY special pricing. We have like our own CNY team at Metro. But there are programs, especially right now, going on. And so, for example, if somebody sends me an email, then we can drop my email somewhere if you want to. Then I will send them an email with all the links to the programs through like Reunite, Reassist, and all those kind of things, military discounts. So there's options for that. But the CNY pricing is already really discounted. So it's very, very competitive. There's special protocol pricing and all those kind of things. So once they send an email, or they can call, they will talk to somebody on the team and they will get all the insurance information. They'll run it, they'll confirm it, they'll get all the pricing. And then when they're ready to place their order, like if somebody's doing research and they're going to order a month in advance, or they want to wait, or whatever it is, we work that out. And then, like I said, once they receive their meds, then I kind of kick in. I feel like I kind of like, can't go personally to everybody's house to like deliver their meds, but I try to do it virtually so that when they receive their meds, they don't feel like they're on their own. It's like somebody standing by. You can reach out to me and I'll be there for you.
Love it. No, that's awesome. No, that's awesome. And lots of people are jumping in and kind of saying, that their meds are getting here soon. And they're so glad that they caught this, because it is so much information. And I harken back to, I always tell this story, but I was a fertility nurse when I went through fertility treatment, and I was still like, holy buckets. Right. When I got that box, I was just like, oh my gosh, like I really truly got a newfound respect for that overwhelming feeling that you get when the meds show up and you don't know what to do with any of it.
Well, and I have to say, I've had critical care doctors, like physicians, who have reached out to me at times and been like, okay, I'm in the ER. I have no idea what's going on with these fertility meds. And it's totally understandable, right? And it's a lot to work through, but it can be worked out. And like that's my big thing is everyone can do it.
Everyone
and it's
absolutely can.
Totally okay to feel not sure. It's totally okay to be scared. It's all those things. I'm big with when you're going through this process, a lot of times, I'm sure you could say it's underestimated how much is involved and like being patient with yourself. And a lot of times I'll hear like everybody's trying to be tough and they want to wait till the end of the cycle to be like, I got through it and I'm proud of myself. And like, I want to kind of give myself the credit. I'm like, no, give yourself the credit on day one. Like you making the call, you having a consult. That's a lot. Absorbing all that, getting all your ducks in a row, all your testing done, getting everything ready, getting your meds, starting your meds every day is like an achievement. Like pat yourself on the back because it's a lot.
Yeah, even that, like you said, that making the call, even the new patient consultation is a huge, we talked about this last week or the week before. I was talking about this with people. It's just that, just the coming to the acceptance that this is where we are, like that this is where I am in my journey. And that is that in and of itself is a big hurdle or a big thing to overcome. So yeah, absolutely. Don't wait until, you've made it through the whole cycle to give yourself a pat on the back. Like, good job, girl. You got this far. Like, that's such a good point.
Totally. I feel like even when it comes to, the stimulating meds, if we start with that, right, in the beginning of the cycle, something like Follistim, I'll usually explain, like, for instance, I have it here. I have all my meds, I have my progesterone, everything. But something like the Follistim pen, a lot of times, like when somebody gets it, they're like, okay. And I'm like, grab hold of it, get used to it,
turn
feel it. Like, let's talk while you have it in your hand and all those kind of things so that becomes more familiar, because I don't look at these things, and I know I've said this to you before, I don't look at these things as medications that are needed because something's wrong. I look at them as the tools in the toolbox for us to reach the goal.
Yep.
Right.
Yep. You've heard me say that before too, which is like, a lot of times I'll make that baseline phone call to somebody and I'll say, listen, it's a toolbox. This is a project. It's a toolbox. You're not going to need all the tools at the same time.
Right.
Just like you're not going to hammer and screw in the project at the same time. Right. So we'll tell you when to grab each tool that you need. And like you said, just getting stuff out and normalizing how it feels, what it looks like, how it works. I know, videos, just sitting and watching some videos on familiarizing yourself with how to do things. Don't expect yourself to know how to do something that you don't know how to do. That's a very unfair expectation of yourself. Just like you wouldn't expect a child to know how to play soccer if you've never taught him or her how to play soccer. The same thing. You shouldn't know how to do these things. So give yourself a little bit of grace. Give yourself a little bit of love. Like, it's okay. We'll get there. So, well, I mean, we're kind of on this topic a little bit, but I know you're a big proponent of it, as am I. But like, let's talk about the emotional aspect of all of these meds and how it makes you feel and what feelings are normal type of deal.
This is a big thing for me because, and I'm sure you experienced this and just have so much experience with it in talking with people, but let's get real, right? These are hormones. And so feeling emotional and feeling edgy and feeling just all over the place is totally expected and understandable. It's just a matter of managing that. And a lot of times, some of the things I work on with everyone can be like keeping ourselves in the present. Like you said, we're here now. It doesn't matter what it took to get here. We're here now. And I'm not minimizing it to say it doesn't matter, but I'm saying if we reflect back too much that way, we can just kind of put ourselves in a place where we're not acknowledging and finding comfort in where we are now. We're at a new starting point. I always say like it's a new game, right? You're starting your cycle. This is an exciting time. It also might just be chock full of big feelings, and that's okay. But I usually say when you're starting, be good to yourself. If you have a partner, work out some plan where over the next 3 weeks, 4 weeks, whatever it's going to be, just when you're like in the real midst of it, to be taking care of each other, taking care of yourself, going on walks, doing like those self-care things. I was joking around that like for me, like a mani-pedi is self-care. It totally is.
Yeah.
And so something like that, talking with somebody who maybe doesn't know anything about it, or someone who you can talk to and confide in. Drinking lots of water so that if you're feeling achy or, extra bloated, a lot of times I've had people say, why would I want to drink more water if I'm already so bloated I can't button my pants? And I'm like, you need to drink that water, right? You need to flush your system. You need to stay well hydrated. It'll decrease if you're having headaches and things like that, hopefully reduce some of the aches. But overall, I think it's getting that mindfulness of anything you're feeling is normal and it's okay. It's understandable. And there may be days that are better than others. There may be days where it's like, I cannot deal, and that's okay. But it is something that every day that you're moving forward in a cycle, you're getting closer to working towards your goal.
Yep.
And like that's a beautiful thing. The journey may not look like it was supposed to. It may not be what you had in mind, but it's still a process and it's still hopefully going to get to ultimately achieving that.
Yeah, no, and that's such a good point. I mean, I love analogies. I love relating one thing to another because I feel like it helps people just to kind of grasp concepts. But, I really feel like, would you be surprised if your muscles hurt after you worked out? You wouldn't be surprised. But you kind of know ahead of time that if I work out, my muscles are going to hurt. And so it's not easier, but makes it, I guess, easier to accept like, okay, my muscles hurt. And that's like kind of what I like about what we're doing and what we're talking about is, yes, you are going to feel bloated. So when you do feel bloated, know that that's normal. You might get headaches. These hormones are all intended to, well, not all of them, but the stimulation medications are all intended to grow follicles. And as those follicles grow and develop, those follicles are secreting estrogen, and estrogen is that thing that makes us all a little nutty sometimes when it gets high. And so to expect that, yes, I'm probably going to feel a little irritated, a little irritable, a little, whatever the case may be. And not everybody feels that way, but just to know that those things could happen so that you can, like you said, normalize it and say, okay, this is what was supposed to happen. So I'm cool with it.
I will have to say, and I'm curious what your experience, if you're willing to share like your personal experience of how you felt, but the one thing I always try and say, especially for everyone who may be on social media in groups comparison is the thief of joy.
Yeah.
Somebody may say, oh, it was no big deal. I didn't feel anything. And I was able to do this and that and the other thing and like super high achieving or all the things. Somebody else may be like, I feel like I can barely get out of bed in the morning. That range, wherever we are, is where you're supposed to be. Just because one person had this experience and someone else had that one doesn't mean you need to do that comparison or size yourself up or anything like that. That to me has been, I love social media. I participated in all the time. But that's the one thing that I say as like a reminder is just take everything a little bit with a grain of salt. Everybody's situation is different, right? Everybody's factors of why we're here together is different.
Yeah. Well, somebody just asked a couple of questions ago. And for those of you who are new joining us, usually Linda and I will chat for the first 20, 30 minutes, and then we'll start batting some questions around. So don't get frustrated if we haven't gotten to your question yet. If I see them though, sometimes I'll work them in. So somebody said, do we still need all these medications if we're doing this because we had our tubes tied? And the answer is yes. Because our bodies are only designed to develop and ovulate one egg a month.
Right.
And because in IVF, we want to go in there one time, hopefully, and be done. We want to grow as many eggs as we can so that we can get them out, fertilize them in the lab, and have some embryos to work with. And so, yes, you do still need, many of the same medications, but like Linda was saying, we're all here for different reasons. So that question was about somebody whose tubes are tied. You're not going to want to take, a Facebook post about, something unrelated and try to apply that to you. And in my personal kind of thing that I say all the time about Facebook groups, I think they're great. I have mentioned before, I live with a chronic illness and I'm a part of a couple of Facebook groups with my specific situation. And so I think they're amazing, but it's interesting to me how much gets said and how many people take their medical advice from these groups. And so just remind yourself, you're there for support, but that is not an adequate place to gather medical advice. To say, for example, sometimes, Linda, I'm sure you've heard this question before. My instructions only say to take one Lupron trigger, but I saw in the Facebook group that all these other people are saying that I need to do two.
Right.
And so why would that? Well, I guess I can answer because I'm the one that does these protocols, but whether you need one Lupron or two Lupron is directly related to your own cycle, how many eggs you have, what your baseline LH was, what your AMH is, how old you are, whether or not you use HCG. There's a lot of different things that determine whether you're going to trigger one versus two. And so just remembering that, support groups are amazing for support, but they are not a substitution for sound medical advice. So that's kind of
and I jump in the Facebook groups too, and I love answering the questions and everything. And one of the things I see often, and it's meant with good intention, is wanting to be helpful. Well, I did 2 Lupron triggers, or I did this protocol, or I did this, and more is not necessarily always what's needed or wanted or going to work more. It really is dependent on the protocol that's been assigned to you based on your factors, based on a number of things. And that's what, and I always kind of refer back to CNY, that's what in all of their experience of thousands of cycles, their expert experience is what would be the best chances for you individually, right?
Yeah.
And so, because I do know a lot of people I'll work with privately will get really wrapped up in like, should I be doing this? Should I be doing this? I want to make sure I have the best chances. And of course, we want to make sure everybody has the best chances, but in the way that's right for that individual.
Exactly. Yep. And that's where it comes down to just making sure that if you do have a medication protocol specific question, definitely just be sure you're using your resources and your support wisely. And so, you would want to reach out to me or Linda if you had a medication question. Whereas if you have a question about, hey, I'm feeling is this normal, or that type of thing, that might be something that would be better to, solicit the support of peers. Whereas if you're concerned or worried about a specific medication protocol, just checking in with us here at CNY Fertility to make sure that that is in fact the right course of action, so to speak. So
I wonder if we should dip into, should we talk about OHSS a little bit? Because I know that gets bounced around a lot, where there's just a lot of concern about it. And I'm not sure, it's not that it's not necessary. Obviously, that's something we want to avoid, but it's something that I'm not sure is fully understood as best as it could be. And sometimes that empowers people to feel a little less worried if they understand it more. Tackle that?
Yeah. So I'll talk a little bit about the pathophysiology, what it is, and then you can kind of jump in terms of meds and tell me, what your experience is. But OHSS is something that a lot of people are super afraid of because they've heard about it. They've heard horror stories. I myself had a little bit of OHSS. It's not fun. What is it? So OHSS stands for Ovarian Hyperstimulation Syndrome. A syndrome is a collection of symptoms all related to something similar. And so OHSS is typically something that happens. So when your ovaries are being stimulated to grow eggs, that's called controlled ovarian hyperstimulation. So we're trying to hyperstimulate your ovaries. Ovarian hyperstimulation syndrome is that collection of symptoms. What are those symptoms? Typically, they start 2 to 5 days after retrieval. Usually, it's perpetuated by the presence of HCG. So oftentimes, even if your estrogen is very high, if you don't trigger with HCG, it's debatable whether you can have true ovarian hyperstimulation syndrome, because it is typically the HCG either from the trigger or the pregnancy, if you do a fresh transfer, that feeds into this OHSS. So essentially, you stimulate the ovaries and then you go in, you surgically remove the follicles. But there's two things that happen when you do that. One, the membrane around the ovaries is stretched out because the ovaries went from being very small to sizable. So that membrane around the outside, which is usually tight like this, has now kind of stretched. And you can kind of see in my horrible charades, but you can kind of see now that membrane has spaces. And then we poke in there with a needle, extract all the fluid. So I want you to think of a time when you had a blister and you pop that blister, you break that blister. What happens to that blister? It continues to leak that fluid out. The ovaries are going to do the same thing. So we've poked in there, we've retrieved all of these eggs, and now we've got stretched out a stretchy membrane around, and we've got little puncture holes. So what happens is that there's fluid that was in there surrounding the eggs. That fluid is now leaking out of the ovaries and putting pressure on your intestines, your stomach, your lungs, your liver. If that fluid gets out of control, essentially, you can have lots of nausea, vomiting, weight gain, trouble breathing, because that fluid is all in places it's not supposed to be. But it's typically something that is, like I said, sort of perpetuated or fueled by HCG. And so, like we talked about briefly, whether or not you do HCG for your trigger is depending on what your risk for OHSS is. Yep. Whether or not you do 1 versus 2 Lupron depends on what your OHSS risk is. So if we're really worried about OHSS for you, we might just do 2 Luprons. We might keep HCG out of the mix altogether. But Linda, talk to me about your experience on the patient side, or hearing these things, and kind of fill in where I might have missed.
No, I think that's such a great example. I usually use like a balloon example, like a water balloon kind of an example too. Like when somebody, has thrown it around and it's sort of still got some water in it, and it's just laying on the, hot summer concrete, and it's kind of just, leaking out water. But from a symptomatic standpoint, being in clinic and having dealt with patients with OHSS, there are things that, centers will do, CNY does, to mitigate that risk, right? Like Elizabeth is saying, obviously, Lupron trigger HCG, depending on what other risk factors that are coming into play. Being aware of symptoms, to me, is a practical, logical thing. Being overly worried to the point where it causes anxiety is where I try to limit that and reduce that, so that there's a not unnecessary burden, like emotional burden of, is this going to happen to me? It's statistically, I don't have exact percentages. It's not that common. It is a known risk factor. But again, through the many, many years of IVF that have been going on with the many, many cycles, like in CNY's case, there are ways to minimize that risk to the best of one's ability. I don't know if that helps. I just know a lot of people have questions about it.
Yeah, absolutely. And, something everybody can do, risk-wise, what are your risk factors? If you are less than 30, your AMH is greater than 4, you have more than 10 mature eggs. These are different reasons why you might be at a higher risk of OHSS than somebody who maybe AMH is 1, they're 40 years old, they have 7 mature follicles. So some things you can do right now to sort of mitigate your risk or diminish it altogether is increase your protein intake. Mm-hmm. We recommend usually 150 to 200 grams a day of healthy protein. Increasing your electrolyte intake. So after retrieval, we talked about that membrane is kind of stretchy and fluid is leaking out into places it's not supposed to be. Electrolytes act in the bloodstream like magnets to water. And so if you've got fluid in places it's not supposed to be, but you fill your vasculature system, you fill your blood vessels with salt and potassium, you fill it with electrolytes from things like Gatorade, Powerade, coconut water. If you're doing keto, make sure that those are sugar-free options. There's a great one called Ultima. You can buy it on Amazon. We drink it around our house just because it's a great sugar-free alternative to Gatorade. But when you fill you're filling your bloodstream with those electrolytes help suck that fluid into the bloodstream so that you can urinate it out through when it's processed through your kidneys. So increasing electrolytes and increasing proteins, those are the two primary things. And then there are times where, we might send a prescription for you to Metro or somewhere else for a specific medication to help sort of tighten that membrane back up so that the fluids aren't leaking out everywhere. But that's such a good one. Jessica was asking, I wasn't symptomatic, but I had OHSS, I believe. I have PCOS. With that, is it better to try to produce more eggs for more of a chance or just to try for one or two? I mean, ultimately in IVF, we're always trying to get as many as we can safely. And so I would say, no, if we've got a chance to get 10, we're going to probably try to go after those 10. But we wouldn't want to hyper stimulate you, knowing that, yes, if you have PCOS, you are definitely at a higher risk for OHSS, because higher PCOS clients tend to have a higher AMH level, more follicles. The more follicles that are in there, that means when we do remove the eggs, there's more follicles to secrete that fluid. So yes, absolutely, you are at an increased risk of OHSS if you have PCOS.
That's a great point. That is such a great point. Like young PCOS, that protein and the electrolytes, because you're starting with probably a higher basal intrafollicle count, you have more follicles to begin with. It's just predisposing. That protein and those fluid and electrolytes will pull that fluid, right? Like I love that, like it sucks it in. And so that allows your body to naturally then flush it out, urinate, all those kind of things.
Yep, exactly. And a really good thing to look at or think about is, you can monitor yourself for the signs of OHSS. I mean, truly and completely, ovarian hyperstimulation syndrome does not really present itself until usually about 2 days after retrieval. And that's just because of the pathophysiology of what's happening, right? Yeah. We extract all of the follicles. Now there are these empty follicles that are making fluid. That fluid is then seeping out of the follicles, out of the ovaries, and then into places it's not supposed to be. But the protein, the electrolytes, and then keeping an eye on some of your baseline things, like how much do you weigh? And are you going to the bathroom enough? Or if you normally, use the restroom and empty your bladder 4 times a day, well, I mean, that wouldn't be very many, but then all of a sudden you're only emptying your bladder once a day, that's a problem. And so keeping an eye on how much you're intaking versus how much you're outputting, those can be other ways to kind of keep an eye on the overall picture. I was going to ask you, I think, totally different topic, but I was wondering what your favorite tips are in terms of organizing the meds and like kind of just keeping track of what you have, what you need, that type of thing. So I know you're really good at that.
So I have over the years tried to do this where I'm a person that needs to compartmentalize and like color code. I'm a color person. I see things better. And so I'm like at 3 different color Post-it notes or whatever it is. Post-it notes are my friends. I have them everywhere. So when you get, your Menopure, let's say, if you're using Menopure, if you have your Follistim or whatever it is, when we're reviewing it, or if you're doing it on your own, if you've got your inventory, you can put a Post-it note on it and remind yourself of this goes in the fridge, or these needles, go with this. A lot of times, when you get your packet of meds, there's just it looks like a lot of needles, right? And there's extras, of course. So even with Follistim, you're having like all of these needles because you're never going to reuse the needle. You're going to use a new one every time. And then in the actual vial packet, it comes with extra needles. And sometimes it's like, wait, am I supposed to be using all these? Well, not necessarily. So a lot of times I'll just say, take one at a time, put a Post-it note on it and write like belly. So you're not questioning where you're injecting these medications. And you're also acknowledging and like almost soothing yourself to be like, This is another belly shot. This is another belly shot. This is, I always break it down as simple as possible. The same goes for refills. If you are like having a high vibration of concern and worry, one of the things you can do is keep track of your meds. If you have 300 Follistim vials and you're taking 300 a night, it's fairly simple to do the math. I'm not great at math, so sometimes you're actually trying to figure out, like based on your dose. If you think you're going to be running out, call a couple of days ahead of time. In that sense, I'm always like, just don't be afraid to advocate for yourself. Don't be afraid to ask the questions. Reach out if it's anything medication related. Reach out to me. You know, a lot of times when you get, I don't have a big pack with me, but sometimes you'll have a big pack of those insulin syringes and needles, like, right? They're just, and there's a lot of them. And it's like, okay, well, what do I do with these? Stick a Post-it note on it. Remind yourself, again, where this injection is going to be shot. You know, these aren't in the backside. These aren't in the butt. If there's a progesterone coming, put it away for now. Oh, now just keep it to the side. So it's not haunting you in any way. You know, and I try to add in some humor and things like that, but really I've seen charts, portfolios, binders, everything under spreadsheets, everything under the sun, whatever it will be to help break it down for you. Sometimes it's writing out the actual instructions from CNY, like that are in the patient portal. So like you have an actual like daily to-do list, so you know. Just so it simplifies things.
Yeah, no. And I think what I love, so I've been a fertility nurse for like 6 years now ish. And so I've seen different places that do it different ways. And so I know many of our clients come to us that this is not their first stop on their fertility journey. And so CNY might not be their first stop. And they're used to having like a calendar that has like the meds written on it. So CNY, we don't do that. And the reason why is because we will start you according to your menstrual period. A lot of clinics will batch their cycles, meaning that there's a cohort or a group of people that are going to go through the stimulation at the same time. And that's where the calendars come in. But what we will do, and I actually printed it out, and then of course I don't have it where I need it, but I intended to show you all that we will always release written instructions to your patient portal for each step of the way. So let's say your baseline today, you went for monitoring this morning and a nurse called you and gave you all of your instructions. She also released to your patient portal a step-by-step list, which says Monday, April 5th, 2021, you're going to take this, 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 and this. And so I love when I get a patient that has questions about something and they email me or something and they send me the actual printout with the things crossed off. I'm like, yes, because I really feel like, well, I'm a big sticky note list kind of person too. And I like to check things off a checklist. But it helps too to make sure. I can't tell you how many times I've called a patient who is stimulation day 6, for example. And I say, okay, so you started your ganirelix this morning, right? No. And I look and I'm like, it was in your instructions. Oh, shoot. Now, yes. And that's a stress that you don't need. So you don't need that stress of, oh, shoot, I didn't start it. I meant to start it. So I know not everybody has a printer. Not everybody can do that. But even if you screenshot it on your phone and use like one of those little apps where you can write on the picture, whatever it takes for you, but to have things organized, like Linda said too, some of the meds that you take are going to be given in the evening. Ganirelix, for example, you're going to give that in the morning for us. And so, maybe you want a orange sticky for morning and a dark black sticky for whatever, for nighttime, morning and night, whatever it might take, just for you to be able to remember what is given when. But you also brought up a really good point about refills. And so do you have a favorite way of sort of, because I think sometimes, clients will say, well, I don't know if I need more meds.
Good point.
If I take a medication every day and I see there's 2 in the bottle left, I know I need to call the pharmacy and get more. But what do you think the best way of keeping track of that is?
2 things. I have a little secret sauce too that I always share one-on-one when I speak to CNY patients, but I'm going to say it here, which is that Follistim, for example, when you get a vial, you'll know on the box how much it is, right? Let's just say it's 300 and your dose is let's go with 225. I don't know. We're just making up
Yeah,
numbers
that's a
here.
popular one.
Okay. You're going to have some leftover in that vial. Okay. But even if your dose is 300 and you've used 300, I always say to everyone at CNY, keep this vial in your fridge.
Yes.
Because there's overfill.
Yeah.
And overfill is very valuable.
Money.
And just keep them in a Ziploc bag together, and then we can work on the rest. But being able to have that as backup, just in case you get into a bind, if you don't have a refill, you have another injection you need to give, you just, it slipped your mind or whatever. But as far as refills go, that's the one thing I try to really empower and share and explain to everyone, that there is a lot that can't be controlled with this process. There's a lot that's not within our control, and that's really hard for us. But one of the things we can control is keeping track of what we need, making sure we have it so we don't run into a bind. So we're not like scrambling the day before, like, oh my God, I have so much stress, I can't get a hold of the medications in time. Like, we ship everywhere in the US, we can do overnight, all that kind of stuff. But we don't want to be in that situation if we can help it, especially if there's a holiday or a weekend. And I don't want anybody in tears because they're worried about compromising their cycle. That's what it comes down to. It's not about convenience, and it's not about making it, it's about just simplifying everything so it can go as smoothly as possible. And there's no doubts and second guessing. So keeping a list, like Elizabeth is saying, of when you see those instructions, checking to see what you have in your inventory. If it's Follistim, as an example, in your fridge, what do I have left? There are times where you were not sure, right? You might need that refill, you might not, you're not sure. But a lot of times you can kind of gauge whether or not you're going to be running out and you definitely need one, or you're probably going to be okay. So I don't know, is there anything else you could add to that as far as when they know?
That's such a good question. And I think too, it's always okay to ask if you don't know and you're unsure, because Rebecca, I was asking, well, we know ahead of time that we will in fact need to order another refill, because I would hate to order it and not need it. And that's such a good point. I mean, these are not medications that you want to just willy-nilly refill just because you might need them. And so I think it's always good, at your baseline call, whenever the nurse calls you to go over everything, we're going to kind of talk through each individual step, and we're going to kind of map out for you around when the retrieval will be, around when you're going to start your ganirelix or cetrotide. We're going to kind of map these things out. And so I think it's just good to make sure you sit down with the list in your patient portal of all the meds that we ordered, the packing slip from the pharmacy, and what you actually have. Make sure you have everything in the correct quantities. Cross-reference that against what was in the patient portal, but then ask that question, okay, so I'm going to be doing 225 units a day. I have this many. Is that enough? I mean, I get a lot of messages through the patient portal that are just, hey, this is how much I have left. Will I need more? That's fine. We don't necessarily expect you to know what you may or may not need, but if you don't ask, then we can't, necessarily guess for you, type of thing. So, so that's a really good point. I think if you're cool, let's start answering some questions, because we both know many of these ladies, they just want to hear. Actually, this is a great question. So Anna was asking, I'm not going to show these on the screen because it pushes it up to where you can't see our faces. But she says, wait, Linda, you help walk through how to do shots? I need injections for dummies. What does that look like?
Okay. So you get your medications from Metro, and in the shipment, you'll get my cell phone number. And you can text me, or you could call me. You should probably text me first, just so that. But this is my rule of thumb, is I am at your disposal. I'm here to support CNY and the community, and I love you all. And so I am I want to help in any way I can. If you text me at 11 o'clock at night, I'm not saying I'm going to respond at 11 o'clock at night. There's a chance I might, but I might wait till the morning. So I usually say, send me it when it's on your mind, or you can send me an email, which my email address is included in there as well. And then honestly, I'll be like, okay, when are you starting? Great to hear from you. When do you want FaceTime? And we just jump on, and we're like fast friends. And it's like, I have done this in the closet. If somebody's in their closet and we're going through their meds because they have a whole shelf organized of it. I've had, people are in their car, and I have done this and been in every situation imaginable. There is nothing off limits. You can ask me anything. And I'm just here to make it a little bit easier if I can. That's my goal. And just be an extra cheerleader.
Yeah, no, absolutely. And I love that. And so, yes, Anna, you can absolutely get Linda or any, there's lots of resources for injections for dummies, and you're not a dummy. Again, you don't know what you don't know. So to expect yourself to know how to do something you've never done, just give yourself a little bit of credit, because
I will add, if I can, if I'm running through, like, let's just say Follistim, and I'm showing it and everything, and I'm not flying through it thinking, oh, you see this lunch, you got it, you're all set. I'm like, okay, let's look through it. Let's do it. You want to do it with me at the same time, and so you get a feel for it. But then I'll also say, check out some videos online, watch it over and over again. I'll give my little tidbits and little tricks and things like that. But overall, it's just a matter of getting a feel for it. And sometimes, like for me, it helps to talk it out with somebody, to have that like one-on-one connection. So
no, absolutely. And to be able to ask questions about it, not feel rushed. Like, for example, I know, I used to always say when I did med teachings in the office, I used to always say that the Follistim is like a flashlight. The battery, the vial, only goes in one way. If you put it in the wrong way, flashlight won't turn on. But just kind of learning the ins and outs of how it works,
I will always say, like, keep that thumb up until you're ready to press down once you're in to do your injection, right? Like if this is actually like my belly, and I'm actually, needle's not on here right now, but let's say it was. My thumb is up until I'm in, and then I'm pressing down. Because I think of it as like, you don't want your finger on the trigger. Because I've had people who lost some because they got nervous and kind of just went like this before they got in, and it's understandable, but we just want to minimize those.
I don't know if you use this tip, but another one that I use a lot when I teach Follistim is that, you can turn forward, but you can't turn back.
I do.
Always wait to put your needle on until you've got that window dialed. Because if you dialed at 325 and you go to turn it backwards, if your needle is attached, guess where that extra 25 is going? Out the front.
Earlier today, that was my first thing that I was reviewing. I was like, I want you to go past your dose on purpose. Because the natural instinct is to turn backwards. And I'm like, but if the needle's on, we're losing something. So
that's right.
Reset the pen. Don't put the needle on until you're ready.
Yeah. So Stacy was asking, and I mean, I can answer this if you don't do gonal, but you've done it before. But Stacy was asking, are they similar? Yes, they are similar in that they're both a pen with a button, a window, and a needle. But other than that, they're pretty different because the gonal F, it's already in the pen. You can't take it in and out. The Follistim is its own cartridge that you can drop in and out.
Yeah. And so this is like an old gonal.
Yeah, so you can kind of see that the medication is preloaded in there, whereas with the Follistim, it comes separately in that little glass vial that you kind of load in and out.
The medication, and this is the actual device to administer the medication.
Yeah, exactly. And so similar, yes, they both, if you're 225, you can use 225 of either. They're both a pen, but in terms of the logistics of kind of just setting it up and using it, a little bit different. Okay, so let's answer some more questions. This is an interesting question. I don't know the answer. Do our meds have to come from Metro Drugs to be able to have a one-on-one with you? I'm guessing probably so.
Yeah. That being said, you could find me on Instagram. Like, I am a big proponent of supporting the fertility community. I've been involved in it for like over a decade, so many years. And so if you were to find me on Instagram and you were to ask me a question, there's a likelihood
you wouldn't leave them hanging. But yes, the one-on-one, the FaceTime, that type of thing, yes, that would be probably something that, would be kind of,
if you're a complimentary service extended to CNY and the community, to basically say you get some one-on-one time, and we want you to feel like there's some consistency from when you have your meds ordered to when they're received, and that you're ready to begin. So we all work collaboratively.
Yes, absolutely. Talisha was asking, can we do a one-on-one with the nurse to discuss our protocol? I'm a little overwhelmed with the amount of meds that were prescribed. You are not alone. It is a lot of medications. And yes, you can always call our office or you can call Metro Drugs specifically if that's where you got your meds. If you didn't get your meds from them and you got them from somewhere else, call that pharmacy. But we're happy to sit down and kind of go through each med with you. But with that said, I want you to give yourself permission, again, to think of that list of meds as a toolbox. You do not need all of the tools at once. And so I think sometimes it's good to take information in bite-sized pieces. So like, for example, Linda, when you do like a opening call with somebody or like a FaceTime and they're starting stim, how often are you going over PIO?
Exactly.
You're not.
No,
because
and I'll break it up.
Relevant
I'll be like,
right
this
now.
is the stim meds we're going to focus on now. And sometimes somebody will want to know, I need to know everything right now. Okay, we're going to run through it. But then I'll be like, text me in, in a little while, like once you're down the road a little, and we'll go over it then so we don't overwhelm at one time.
Yeah, exactly. Because at some point, if it's so much information, then it just becomes, it becomes, oops. Oh, sorry, Rebecca, that was your question from earlier. But yeah, it just becomes so much information that, then you're actually like diminishing how much you remember because some of it's not relevant now and, you forget other stuff. So that's a really good question.
Yeah, that is.
Oh, this is a good question from Cassandra. She says, how much weight can I expect to gain with the meds? I'm currently trying to lose weight, but this is something I worry about.
Of course. I don't know what you would say, Elizabeth. I will absolutely say in the experiences that I've observed and been part of, it varies, obviously. It does depend. And I also know a lot of women are trying to improve their nutrition, do keto, reduce, lose some pounds and things. And that's a lot of added pressure. That's a tricky one because it does depend on the person.
Yeah. I mean, my thing is I usually say, don't be surprised if you gain 3 to 5 pounds.
A couple of pounds. Yeah.
Yeah. A couple of pounds. I mean, especially because we use prednisone in a lot of our protocols, and prednisone is going to be one that you're gonna probably gain a little bit of weight. I mean, for me personally, I think it was maybe 3 pounds or something like that between the time I started meds and like my next period after my retrieval or something like that. Yeah. But, some people it's none, some people it's, it's a little bit more. I think it's good to remember that the meds themselves don't necessarily make you gain weight unless it's just from bloating. But she says, okay, great. Not like 20 or 30. Awesome. Oh, no, Cassandra. No. If you gain 20 to 30 pounds, please reach out to us immediately. No, my friend, you will not gain 20 to 30 pounds. We're looking at a couple of pounds at most. And usually that is just extra fluid that eventually when your body sort of evens itself back out. But I used to work with a doctor that used to say this a lot. And I think it's important to remember, which is that the meds themselves, other than a little bit of water weight, aren't necessarily going to cause you to gain weight, but they are making hormonal changes that might change your appetite and your eating patterns. And so you might find yourself starving, hungry for, at 10 o'clock at night because it's a lot of hormones that are raging through your system. And, you find yourself off the keto wagon at that time or something like that. Yeah. And so just, again, being cognizant of the fact that, okay, am I hungry or am I bored? Am I hungry or am I hormonal? And just kind of balancing that out can help. I know it did me.
I think that's great. I will also add that as far as the weight gain might feel, it might be shocking if it's, 2-3 pounds and it feels like 10 and it's like, why is it? But that's because, again, we have some stimulation going on in the ovaries and things are going to get bloated in that area, and it's a feeling sometimes where you just feel weighted down. I know I talked to a lot of women about progesterone because of this, because progesterone can slow down that gastric motility. So it slows down our stomach. It can cause constipation and other things and kind of that crampiness. And so that also can just kind of in general feel like you're feeling that weight, even though it's maybe a couple of pounds.
Yep. Yep, exactly. And I remember walking through the office when I was on like simulation day 9 or something like that and feeling like I was waddling. I'm like, why am
Yeah.
I waddling? But like Linda said, your ovaries are being stimulated. They're normally really little and they're tucked in this nice little neat area in your pelvis. And then all of a sudden we're stimulating them and blowing them up and they're coming up, and out a little bit, and they're going to make things look like oftentimes a lot more, or it will feel like a lot more than it is. So,
great question.
Yeah. All right. Let's answer a couple more, maybe 2 more, and then we could talk all night. I know we could.
Totally could. Yeah.
Somebody was asking, I do want to answer this, about, where was it? Hold on. Omnitrol, can you prime for 60 days? Yes, you can. So priming is something that we do a lot here at CNY Fertility. And the concept behind it is to prepare or prime the ovaries to be receptive or ready to go when it's time to stimulate them. And so that is a really good question. And yes, 30, 60, 90-day priming, great. And then I'm going to bounce this one to you, but because PIO, progesterone is always a good topic, but what's the difference or benefits between progesterone injections versus inserts? What are your thoughts?
So,
and I'll tell you kind of the CNY thought as well, but I want to hear yours.
I was asked this last week, actually, by a CNY patient, and I was saying, they were basically asking me, do I have to do the injections? They're prescribed. Do I need to do them versus vaginal or oral? And I was saying, it's an absorption thing. It's being absorbed. It's an intramuscular injection that's going into the muscle. It is the most, or arguably one of the most important injections and medications of a cycle. And it's extremely important, or we wouldn't spend so much time and energy doing that. It's not that we want everyone to go through doing those injections if necessary, but it really is sometimes necessary. I know, obviously, barring any allergic reaction or sensitivity or anything like that, I know that different centers do different things, and it depends on comfort levels and things like that. I will say, my theory is if you put through so much energy and effort getting to this point, and emotional investment, financial, physical investment, it is one of the things that you are doing to hopefully help support, prepare, and then continue a healthy pregnancy. And so it really is, it's a key. It's a really important part. I wish there was another way around it. That's
no, and I mean, I talk about this a lot, but if you understand the reason why, I feel like it's easier to accept that this is just how it's going to be. And the reason why is because in a natural pregnancy, your body ovulates an egg, and that spot from which you ovulated becomes your little progesterone support center. So your body makes all the progesterone, or is supposed to, makes all the progesterone that's needed to support the pregnancy. In this type of pregnancy, your body doesn't have its own little progesterone factory. So if you're not supporting the progesterone from the outside, progesterone is the pregnancy hormone. Without it, there is no pregnancy. So, that's the reason why we use vaginal and intramuscular. Again, like Linda mentioned, it's an absorption thing. The progesterone in oil is sort of the gold standard for slow, steady administration of progesterone. Whereas we know some people, they process or absorb the vaginal progesterone a little bit better. Research studies are pretty clear that using both forms is preferable to just one, so that we can offer different forms or different forms of absorption. Genevieve, she's the one that was asking about the different types of progesterone. She says, I hate those freaking inserts and the mess. And yes, they are messy. They can be problematic. What I would say is, in your specific case, message us through the patient portal. We can look back through cycles records and see maybe your progesterone levels after transfer have always been really awesome. And we feel like, we could probably get away with just the progesterone and oil. That is a potential, but we don't know, I would want to say for you specifically, let's take a look at it. Some people get really irritated from the inserts. And so for that reason, sometimes we switch to just, just the injections. But the research is pretty clear that both forms together is the best method, so that we can make sure we've got you covered, because too much progesterone is very unlikely. Too little progesterone happens all the time, and it is the surefire way to end a pregnancy.
Yeah, and
if you don't have enough.
I will mention also my my analogy that we love to do is you're creating this fluffy pillow sort of for an embryo to just implant into and just be really comfortable and grow and develop, and you need that fluffy lining to be thick enough and built up enough to help support the pregnancy. And like Elizabeth's saying, if you don't have that, and that's fairly common that can happen, this is something we can do to mitigate that. We know that we're supporting progesterone levels in that way. So it is super duper important.
Yeah, and Deshauna was asking, just to pigtail on that, and then we will wrap up. But can estrase and progesterone be added to a modified natural FET? And I would say yes, and you probably should. Mm-hmm. And my little mantra with that is, you are in our care here at CNY Fertility because your body has not done this on its own for whatever reason, and so to not take or support or supplement progesterone and to kind of leave it to your body to like hope that it does what it's supposed to do just seems like, kind of like Linda was saying, we've come this far, we've spent this much time and money and emotional capital. Just take the progesterone. I promise you can do it. I did all 70 of my own progesterone injections to myself. I promise you can do it. You will do it. And every single shot or insert or what have you is just one step closer to that goal of getting where we want to go and what we want to do. So
I've done my own IM injections, and I've always told people that I've never not been able to get somebody through it. I'm not willing to fail now. I'm on a roll.
Yeah.
Many years, and you can do it. You can.
Yeah. Do it. Yeah. And you can download on your phone. You can download like a countdown app, number of days until, I uploaded a picture of that darn vial, and 22 days, 21 days, every day it came. I knew I was getting that much closer to my goal, which was, okay, now I'm far enough along that my body can do this on its own and I can stop these shots. And that was a huge rite of passage. So, any final thoughts? I just love when you come on. I feel like it's so helpful, and this is so much of the stuff that we all need to know and want to know. But any parting thoughts?
I love it. I just want to send out that reminder that everyone that's involved in this in some way, whichever protocol you're on, you're here for a reason. This was part of the journey, whether it was intended or not, and you can do it. And that doesn't mean you're always going to feel like you can, but you can. And sometimes we have to go through these clouds, and we don't know if we can really see through them until we're in them, but just know people are here for you. We support you. We're sprinkling baby dust all around. We really do cheer you on. And I'm just really thankful to be a part of it. I love supporting everyone on this journey in any way. Families come in all different shapes and sizes, and it's a privilege to be a part of it.
They sure do. Last question, only because Destiny, I saw you asked it a couple times, and I do not want to leave a girl hanging on an important question like this. I'm doing transfer tomorrow. Should I take my morning meds and progesterone and endometrium? Normally, yes. We say if your transfer is before, usually we say before noon, you're going to hold your morning inserts, but you're still going to take your oral and your injectable. If it's sometime in the afternoon, then still do your morning insert. But great question. And thank you again, Linda. Thank you so much, everybody, for joining us. Linda's going to come back with us probably about once a month, just so we can kind of rehash these things, revisit these things, because it's such an important part of the process. And so, so we'll say goodnight for now. Thank you guys all so very much. If you do have specific questions about your own stuff, your own protocol, you heard or saw something here that you have questions about, just send us a message. That's what we're here for. Linda's information is in the ticker at the bottom. You can reach her at Linda S at metrodrugs.com, at Unboxed Mom on Instagram. And then I also dropped her email address in the feed. So if you guys have questions, you want to reach out to, directly to her, please do. Otherwise, we will see you all next week. Okay, everybody have a